Hello everyone, I am Shikaina Aquino and today I am going to perform Leopold's maneuver return demonstration. Leopold's maneuver is used to systematically palpate the gravid uterus. It is an easy to perform, non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. Leopold's maneuver is done after 36 weeks gestation to help the expectant mother and the healthcare provider be better prepared for the labor, and it also helps in determining if it is much safer to perform cesarean section. Prior to the conduct of the procedure, I have prepared the necessary equipments needed, which includes a pillow, a towel, and a stethoscope. Next, I have performed hand washing to protect my patient and myself as well from infection and cross-contamination. Good morning, ma'am. I'm Shikaina Maranga, your student nurse for today. And may I see your wristband? Please state your complete name. And your birthday, please. Okay, thank you. And how would you like me to call you today, ma'am? Alright. Okay, so ma'am, today we'll be doing the Leopold's maneuver. It is an easy method which we use to determine the position of your baby inside your uterus. Okay, so later what I'm going to do is to feel your abdomen and add a little pressure so that I can feel and determine the position of your baby. Will that be alright? Okay, so will it be fine if I close the door so no one from outside will be able to disturb you while we're doing the procedure? Okay. Okay, ma'am, so before we begin, I encourage you to void first so that later you won't feel uncomfortable. Okay. An empty bladder promotes comfort and allows for a more productive examination. On the other hand, a distended bladder may obscure the fetal contour and may slightly deviate the uterus. Okay, ma'am, so you're back. You're done voiding. Alright, I need you to lie down and slightly flex your knee. And I need you to turn to your side a little, so that I can place a towel underneath your hip, okay? Okay. Position the patient supine with one pillow under her head, and a flexed knee would relieve the tension in the abdominal musculature, and placing a towel beneath the patient's hip will displace the uterus off of the inferior vena cava and the aorta, thus preventing supine hypotensive syndrome. Okay, so now we're going to begin. I'll be needing to expose your abdomen. Okay, to begin with the procedure, expose only the area of examination, and if right-handed, stand at the patient's right side. And now I am going to proceed with the first maneuver, which is called the fundal grip. Now face the patient and palpate the uterine fundus to determine which part of the baby is at the upper part of the uterus. It may be the fetal head or the breech. The fetal head feels round, hard, freely movable, and ballotable, while breech feels softer and nodular. Okay. Now I am going to proceed with the second maneuver, which is called the umbilical grip. What I'm going to do is to palpate downwards on the lateral uterine surface and determine the fetal back or fetal extremities. Okay, apply a gentle but deep pressure. And alright, that's it. Now proceeding to the third maneuver, which is called the Pollock's grip. And to do this, I am going to place my hand over the symphysis pubis, grasp the lower uterine segment with my thumb and fingers, and determine if engagement has already occurred. Alright, so now I'm going to proceed with the fourth maneuver, which is called the pelvis grip. This is done to determine the findings of the third maneuver, as well as determine the presenting part that is in the hypogastrium of the mother, and also determine the cephalic prominence. So if prominence is at the same side as of the fetal extremities, then the head is flexed. But if the prominence is of the same side as of the back, then the head is extended. Okay, now that we're done with the maneuvers, we're now going to locate the fetal back again and listen for the fetal heart tone. Okay, ma'am, so we're done with the palpation of your abdomen. I am now going to listen for your baby's heartbeat, okay? Locate the fetal heart tone and listen for it for at least 1 minute. Okay, ma'am, so we're done with the procedure. I am going to cover you up now. Okay. So are you comfortable? Alright, so after doing the procedure, I have determined that your baby is at your right side and that your baby is in cephalic position, which means the head of the baby is at the lower part of your uterus and it is already engaged. This is an ideal position of the baby for labor. Also, when I was listening for your baby's heart sound, I have counted it and it is in 125 beats per minute, and that is normal. Okay, so do you have any questions? Okay, thank you. After doing the procedure, proceed to performing hand washing and the documentation of the findings.